A central service technician finds that a surgical instrument has a loose screw during inspection. What should be the technician's next step? A. Tighten the screw and send the instrument for sterilization. B. Set the instrument aside and notify the supervisor. C. Continue processing the instrument as it is. D. Replace the screw with one from another instrument. Answer: B. If a technician discovers a loose screw, the instrument may not function correctly and could pose a safety risk. Notifying the supervisor, B, ensures the instrument is evaluated and repaired properly. Tightening the screw on their own, A, might not be advisable without proper tools and training. Continuing processing, C, or replacing the screw with one from another instrument, D, could compromise the instrument's integrity and patient safety. What is the appropriate action if a central service technician accidentally drops a sterile instrument on the floor? A. Wipe the instrument with an alcohol pad and use it. B. Reprocess the instrument immediately. C. Inspect the instrument for visible dirt and proceed with its use if clean. D. Use the instrument if it's urgently needed. Answer: B. Any sterile instrument that has been dropped is no longer sterile and must be reprocessed. B. Simply wiping it, A, or inspecting it, C, does not ensure sterility. Using a compromised instrument, D, could introduce contamination, risking patient safety. During the decontamination process, a technician notices that the water temperature is below the recommended level. What should the technician do? A. Continue decontamination with the current water temperature. B. Increase the duration of the decontamination process. C. Stop the process and adjust the water temperature to the recommended level. D. Use a chemical disinfectant to compensate for the low temperature. Answer: C. The decontamination process relies on the correct water temperature to effectively remove bioburden. Continuing with a low temperature, A, or adjusting the duration, B, would not guarantee proper decontamination. The technician should stop and correct the temperature, C, to meet guidelines. Using a chemical disinfectant, D, might not be effective if the temperature is still below the required level. A technician is preparing an instrument set for sterilization and notices that one of the instruments has a slight bend. What should the technician do? A. Straighten the instrument manually and include it in the set. B. Set the instrument aside and continue preparing the set without it. C. Report the issue and send the instrument for repair or replacement. D. Include the instrument in the set as it is if it's not severely bent. Answer: C. A bent instrument may not function properly during surgery and could be a safety hazard. Reporting the issue and sending the instrument for repair, C, is the best course of action. Straightening it manually, A, or including it as is, D, might compromise its integrity. Preparing the set without reporting, B, could lead to improper inventory tracking and future issues. What should a central service technician do if they find a tear in the packaging of a sterile instrument? A. Use tape to seal the tear and proceed with use. B. Replace the torn packaging and reprocess the instrument. C. Proceed with use if the tear is small. D. Sterilize the instrument again without changing the packaging. Answer: B. A tear in sterile packaging compromises the sterility of the instrument. The packaging should be replaced and the instrument reprocessed, B, to ensure sterility. Using tape, A, or proceeding with use, C, without reprocessing risks contamination. Sterilizing the instrument without changing the packaging, D, does not address the compromised barrier. During routine sterilizer maintenance, a technician notices that the sterilizer's temperature is consistently lower than the set point. What should the technician do? A. Adjust the set point to match the actual temperature. B. Report the issue immediately and take the sterilizer out of service. C. Continue using the sterilizer but increase the cycle time. D. Ignore the discrepancy as long as the sterilization cycle completes. Answer: B. A sterilizer that does not reach the correct temperature may not effectively sterilize instruments. Reporting the issue and taking the sterilizer out of service, B, ensures patient safety. Adjusting the set point, A, or increasing the cycle time, C, does not correct the underlying problem. Ignoring the issue, D, could result in the use of non-sterile instruments. If a technician encounters instruments with visible organic material after the cleaning process, what is the appropriate action? A. Proceed with sterilization, as the sterilization process will remove the organic material. B. Manually scrub the instruments and then send them for sterilization. C. Reclean the instruments using an enzymatic cleaner. D. Wipe off the organic material with a dry cloth and continue processing. Answer: C. Visible organic material on instruments after cleaning indicates that the cleaning process was insufficient. Recleaning with an enzymatic cleaner, C, ensures the removal of organic material before sterilization. Manually scrubbing, B, might not be as effective, and wiping with a cloth, D, would not remove all contaminants. Proceeding to sterilization without recleaning, A, could result in non-sterile instruments. A biological indicator, BI, fails in a sterilization cycle. What should be the technician's immediate course of action? A. Rerun the cycle with a new BI. B. Quarantine the load, report the failure, and reprocess the instruments. C. Ignore the BI failure if the chemical indicators passed. D. Use the instruments if the procedure cannot be delayed. Answer: B. A failed BI indicates that sterilization was not successful. The correct response is to quarantine the load, report the failure, and reprocess the instruments, B, to ensure patient safety. Rerunning the cycle, A, without addressing the issue could lead to repeated failures. Ignoring the BI failure, C, or using the instruments, D, risks infection and other complications. When handling a sharps container that is nearly full, what is the correct procedure for a central service technician? A. Press down the sharps to create more space. B. Continue using the container until it is completely full. C. Seal the container and replace it with a new one. D. Empty the sharps into a larger container to consolidate waste. Answer: C. A sharps container that is nearly full should be sealed and replaced with a new one, C, to prevent injury and contamination. Pressing down the sharps, A, or continuing to use the container, B, increases the risk of exposure. Emptying the sharps into another container, D, is unsafe and not standard practice. A central service technician is using a chemical disinfectant with a known expiration date. What should the technician do if the disinfectant has expired? A. Use the disinfectant if it still smells strong. B. Dilute the disinfectant to extend its usability. C. Dispose of the expired disinfectant according to facility protocol. D. Mix the expired disinfectant with a new batch to increase effectiveness. Answer: C. Using expired disinfectants can compromise the effectiveness of the decontamination process. The correct action is to dispose of the expired disinfectant following facility protocol, C. Using A. Diluting, B, or mixing, D, expired disinfectant is not recommended as it may not effectively kill pathogens. A central service technician notices that a sterilization load has been processed without placing a chemical indicator inside the packs. What should the technician do? A. Distribute the packs for use since the sterilization process was completed. B. Open the packs, place the chemical indicators inside, and reprocess the load. C. Discard the entire load and start over. D. Use the packs as they are and include chemical indicators in the next load. Answer: B. Chemical indicators are crucial for confirming that sterilization conditions were met inside the packs. If they are missing, the packs should be opened, the indicators placed inside, and the load reprocessed. B. Distributing the packs, A, D, without indicators risks using non-sterile instruments. Discarding the entire load, C, is unnecessary if the packs can be reprocessed. What is the recommended action if a technician finds rust on a surgical instrument? A. Wipe off the rust and continue processing. B. Include the instrument in the set if the rust is minor. C. Soak the instrument in an anti-rust solution. D. Send the instrument for repair or replacement. Answer: D. Rust on a surgical instrument can compromise its integrity and effectiveness. The instrument should be sent for repair or replacement. B. Wiping off the rust, A, or soaking it, C, does not address the underlying damage. Including a rusted instrument in a set, D, could introduce contaminants and compromise patient safety. If a sterilizer's mechanical indicator shows that the cycle was not completed, what is the appropriate next step for the technician? A. Use the instruments since other indicators passed. B. Rerun the sterilization cycle with the same load. C. Report the issue and inspect the sterilizer for malfunctions. D. Document the incomplete cycle and proceed with distribution. Answer: C. A mechanical indicator showing an incomplete cycle suggests a potential malfunction. The technician should report the issue and inspect the sterilizer, C, before reprocessing the load. Using the instruments, A, or simply rerunning the cycle, B, without addressing the issue could result in incomplete sterilization. Documenting without resolving the issue, D, is not sufficient. During the decontamination of instruments, a technician accidentally splashes their eyes with a chemical disinfectant. What should they do immediately? A. Wipe their eyes with a dry cloth. B. Continue working and rinse eyes after completing the task. C. Rinse their eyes with water immediately for at least 15 minutes. D. Apply a neutralizing solution to their eyes and continue working. Answer: C. In the event of a chemical splash, the immediate response should be to rinse the eyes with water for at least 15 minutes, C, to prevent injury. Wiping with a cloth, A, or waiting to rinse, B, could worsen the damage. Applying a neutralizing solution, D, is not recommended without first flushing the eyes with water. A technician discovers that a load of instruments was not properly dried before sterilization. What should be the technician's next action? A. Allow the instruments to air dry and then proceed with sterilization. B. Remove the instruments, dry them thoroughly, and then restart the sterilization process. C. Continue with sterilization since the drying process will occur during the cycle. D. Use a towel to manually dry the instruments and proceed with sterilization. Answer: B. Proper drying is essential to ensure effective sterilization. Wet instruments can cause steam to condense, leading to incomplete sterilization. The correct action is to remove the instruments, dry them thoroughly, and restart the sterilization process, C. Air drying, A, or manual drying, D, without reprocessing is insufficient. Proceeding with sterilization while wet, B, is not advisable. During a routine inspection, a technician finds that a sterilization load printout indicates a temperature drop during the cycle. What should be done? A. Ignore the temperature drop if it was brief. B. Rerun the load and monitor the temperature closely. C. Quarantine the load and report the incident to a supervisor. D. Proceed with using the instruments if the cycle completed. Answer: C. A temperature drop during a sterilization cycle can compromise the effectiveness of the process. The load should be quarantined and the incident reported to a supervisor, C, to prevent the use of potentially non-sterile instruments. Ignoring the drop, A, or rerunning the load without further inspection, B, might not address the underlying issue. A technician is preparing to clean surgical instruments that have been soaked in saline. What precautions should they take? A. Use plain water to rinse off the saline before cleaning. B. Proceed with cleaning without rinsing the saline. C. Use an enzymatic cleaner to neutralize the saline. D. Apply a rust inhibitor to the instruments before cleaning. Answer: A. Saline can corrode surgical instruments if not removed properly. Rinsing with plain water, A, before cleaning ensures that the saline does not contribute to corrosion. Proceeding without rinsing, B, or using an enzymatic cleaner, C, does not address the issue of salt residues. A rust inhibitor, D, is not necessary if the saline is properly rinsed off. What should a technician do if they find an instrument set that was mistakenly left out of the sterilization cycle? A, include the set in the next sterilization cycle. B, hand wash the set and send it to the operating room. C, notify the supervisor and document the omission. D, sterilize the set immediately in a flash sterilizer. Answer, C. If an instrument set is missed in the sterilization process, the technician should notify the supervisor and document the omission, C, to ensure proper tracking and accountability. Including the set in the next cycle, A, or sterilizing it immediately, D, without documentation might lead to confusion and potential safety risks. Hand washing and using the set, B, is not appropriate for sterile instruments. A technician is preparing instruments for a low-temperature gas plasma sterilizer. What must be ensured before placing the instruments in the sterilizer? A, the instruments are thoroughly dried. B, the instruments are wrapped in cloth. C, the instruments are soaked in an enzymatic cleaner. D, the instruments are loaded loosely without contact. Answer, A. Low-temperature gas plasma sterilization requires instruments to be thoroughly dried, A, because moisture can interfere with the sterilization process. Wrapping in cloth, B, or soaking in enzymatic cleaner, C, is not appropriate for this type of sterilization. Loading instruments loosely, D, is important, but drying is the most critical step. During a routine sterilization quality control check, a technician finds that the chemical indicator has not changed color. What should be the immediate course of action? A, ignore the chemical indicator if the cycle parameters were correct. B, run a new sterilization cycle with the same load. C, quarantine the load and report the failure. D, replace the chemical indicator and repeat the check. Answer, C. A chemical indicator that does not change color indicates that the sterilization process may not have reached the required conditions. The appropriate action is to quarantine the load and report the failure, C, to prevent the use of potentially non-sterile instruments. Ignoring the indicator, A, or rerunning the cycle without further investigation, B, could result in unsafe practices. A technician is tasked with storing sterile instrument sets. What is the most important factor to consider in storage? A, the sets are stored in an easily accessible location. B, the sets are stored with labels facing outward. C, the sets are stored in a clean, dry environment. D, the sets are stored on the top shelf for easy retrieval. Answer, C. The most critical factor in sterile storage is maintaining a clean, dry environment, C, to prevent contamination. Accessibility, A, label placement, B, and shelf positioning, D, are important but secondary to ensuring that sterility is maintained. If a technician finds that an instrument was mistakenly included in the wrong sterilization cycle, what should they do? A, reprocess the instrument in the correct sterilization cycle. B, use the instrument if it appears clean. C, notify the supervisor and document the error. D, include the instrument in the next scheduled sterilization cycle. Answer, C. An instrument included in the wrong sterilization cycle may not be sterile or safe for use. The technician should notify the supervisor and document the error, C, to ensure the issue is properly addressed. Reprocessing, A, without documentation might lead to further errors. During an inspection, a technician finds that the seals on a sterile package are compromised. What should be done with the package? A, reseal the package and continue using it. B, replace the seals and reprocess the package. C, discard the package and reprocess the instruments. D, use the package if the instruments are needed urgently. Answer, C. Compromised seals indicate that sterility may have been breached. The package should be discarded, and the instruments reprocessed, C, to ensure patient safety. Resealing the package, A, B, or using it urgently, D, could lead to contamination. A technician is responsible for processing endoscopes. What is the first step in the cleaning process? A. Submerge the endoscope in a disinfectant. B. Flush the channels with a cleaning solution. C. Wipe the exterior with a disinfectant wipe. D. Soak the endoscope in an enzymatic cleaner. Answer, B. Flushing the channels with a cleaning solution, B, is the first step in cleaning endoscopes to remove internal debris. Submerging, A, wiping, C, or soaking, D, might follow, but flushing the channels is essential to ensure thorough cleaning. If a technician discovers a hairline crack in a surgical instrument, what should they do? A. Ignore the crack if the instrument is still functional. B. Report the crack and remove the instrument from service. C. Continue using the instrument until it breaks. D. Repair the crack using a sealant. Answer, B. A hairline crack in a surgical instrument can compromise its integrity and safety. The technician should report the crack and remove the instrument from service, B, to prevent potential failure during use. Ignoring, A, or continuing to use the instrument, C, poses a risk to patient safety. Repairing with a sealant, D, is not appropriate for surgical instruments. A technician is preparing to disinfect a respiratory therapy device. What is the most critical factor to ensure effective disinfection? A. The device is dismantled according to manufacturer instructions. B. The device is soaked in disinfectant for an extended period. C. The device is rinsed with hot water before disinfection. D. The device is wiped with a disinfectant cloth. Answer, A. Dismantling the device according to manufacturer instructions, A, is essential to ensure that all parts are properly disinfected. Soaking, B, or rinsing, C, without dismantling may not reach all areas of the device. Wiping with a disinfectant cloth, D, is insufficient for thorough disinfection. What is the best action for a technician to take if they find that the decontamination room's air pressure is lower than the recommended level? A. Continue working and report the issue at the end of the shift. B. Increase the air conditioning to improve air circulation. C. Stop decontamination activities and report the issue immediately. D. Open a window to increase air pressure. Answer, C. Proper air pressure in the decontamination room is essential to prevent the spread of contaminants. The technician should stop activities and report the issue immediately, C. Continuing to work, A, or attempting to adjust the air conditioning, B, does not address the issue. Opening a window, D, is not appropriate as it could introduce contaminants. A technician is responsible for processing single-use medical devices. What is the correct procedure? A. Clean and sterilize the devices for reuse. B. Discard the devices after a single use. C. Reprocess the devices if they appear clean. D. Store the devices for future use. Answer, B. Single-use medical devices are designed for one-time use only and should be discarded after use, B. Cleaning, sterilizing, A, or reprocessing, C, single-use devices is against guidelines and could pose safety risks. Storing them for future use, D, is not permitted. What is the correct action for a technician if they find a sterilization load where one item was not documented on the sterilization record? A. Document the item and continue with distribution. B. Reprocess the entire load and correct the documentation. C. Notify the supervisor and correct the documentation. D. Use the load as it is if the sterilization cycle was completed correctly. Answer, C. Proper documentation is essential for tracking and accountability. The technician should notify the supervisor and correct the documentation, C, to ensure accuracy. Reprocessing the entire load, B, is unnecessary if only documentation was affected. A technician notices that the autoclave chamber has residue after a sterilization cycle. What is the appropriate next step? A. Ignore the residue and continue with the next load. B. Clean the chamber according to manufacturer guidelines before the next use. C. Run a cleaning cycle without instruments. D. Report the residue to the supervisor and continue with the next load. Answer: B. Residue in the autoclave chamber can affect the effectiveness of sterilization. The technician should clean the chamber according to manufacturer guidelines, B, before processing the next load. Ignoring the residue, A, or running a cleaning cycle, C, without proper cleaning might not remove the residue effectively. Reporting the residue, D, is important, but cleaning should be done before the next load.